The BMA is a trade union and a professional organisation that represents medical students and doctors across the UK. We now have over 150,000 members active in the organisation. I mean, digital is completely changing the world for everybody, and for doctors and medical students it brings all sorts of possibilities. The new website came about as part of a whole kind of review of how we communicate with our members, and for the first time ever really turned it round to them. But also, really importantly, it starts to be one of our key engagement vehicles.
I'm really excited that we're using Sitecore with the BMA because it means that they've seen that this is a long-term plan rather than a quick fix for their website.
So when we were looking at Sitecore, we were looking for something that we could be sure we'd be able to implement in a reasonable time frame and could meet the business needs, and it's satisfactorily done all of those things. We actually got the new site up and running in a few short months compared to those couple of years last time. Everybody's much happier with the way the system works.
We ended up choosing Precedent, and it was quite early on in the process it became clear that they were our kind of favourite candidate, partly because they asked us as many questions as we asked them, and so they really thought about strategy from the very beginning. I think it would have been very easy for lots of people just to build us the thing we asked for, which may not have been what we really needed long term. There are a couple of things that really shone out, I think, for us. One was that they've worked with a lot of membership organisations, and there are some common factors affecting all membership organisations about how do you get engagement in the kind of digital age, and that was really helpful to us.
You know, we really make sure that our consultants and our designers work together to understand what the problem is, and that all feeds into one another, so we never do the design in isolation.
And we also did user testing with real doctors, and having real users gave us great insight into what we needed to do and how we needed to develop the site.
Sitecore's really powerful, is it can join all those interactions up into a story so that we actually understand the interactions over the whole period of time that someone's coming in and using the website.
The new website is unrecognisable from the old website, which is a very good thing. I think what you've got is a very different look and feel, and something that looks much more contemporary for our members, but also it's had that real strategic thinking to get the structure right.
Probably one of the big significant changes that anybody would see from the outside is the way the screens look, the interaction.
The search was very problematic, and that's something we've invested quite a lot of energy and resource into resolving.
I think we're very pleased, with what we've built so far, but it is only a start.
We're now working with BMA on the next vision over the next 5 years. Because Sitecore is such a powerful platform, that can scale to support that underneath. But also it's a great framework to integrate with other enterprise solutions.
One of the success factors is not just delivering the site, it's actually the relationship we've had both with Sitecore and Precedent in terms of that working relationship.
So we're really delighted with the product that Precedent have built for us. It's exactly what we wanted. It was to time, it was to budget. We're absolutely convinced that this is the right relationship, and Precedent are there for us all the way now.